Welcome to Health Fact 10M.
If you struggle with joint pain in your knees, hips, or ankles, then this video is exactly what you need. Most people don't realize that reduced cartilage thickness is one of the major causes of joint pain and arthritis. When cartilage becomes thinner or begins to wear down, the joint loses its natural cushion, leading to friction, stiffness, swelling, and long-term discomfort. But here's the most encouraging part. Research now shows that you can increase the thickness and quality of your cartilage through specific, targeted exercises. However, this must be done the right way. So in today's video, I'll explain not only how cartilage responds to exercise, but also the precise method you should follow to help your joints heal, strengthen, and stay active for years to come. Just like how gradually increasing resistance makes your muscles grow bigger and stronger, and slowly adding load to your bones makes them denser and more resilient, cartilage also responds to progressive loading. Studies show that even if you already have osteoarthritis, the cartilage that remains can improve in both quality and thickness when exposed to carefully controlled forces. The key is to increase the load slowly, consistently, and with the right type of movement. So what kind of exercises actually help cartilage? Thin or damaged cartilage doesn't respond well to pounding, jumping, or high-impact activity. Instead, it responds best to steady, consistent pressure and a smooth gliding motion, where the joint angle changes in a gentle, rhythmic cycle. Exercises like cycling, elliptical, cross-trainer workouts, and rowing create this ideal gliding movement, but there are a few important guidelines you must follow. 1. Maintain a slow to medium pace. For cycling or the elliptical, try to aim for about 60 cycles per minute. For rowing, stay around 20 strokes per minute. Maintain this rhythm steadily rather than rushing or pushing too hard. 2. Exercise for about 10 to 15 minutes a day. This duration is enough to stimulate cartilage growth without overloading your joints. Doing more too soon can actually slow healing because cartilage needs time to recover. 3. Monitor your pain level. A small amount of discomfort is normal, but keep it around 3 out of 10 on the pain scale. If your pain increases or you notice any swelling, reduce the intensity and let your joints settle. 4. Start very gently. For the first few days, simply test how your joints respond. Once your body adjusts, gradually, over weeks and months, begin adding other low-impact activities such as brisk walking on even ground, body weight strengthening exercises, and eventually very light, slow jogging. Keep each of these sessions under 15 minutes. After several months of consistent training and gradual progress, many people can safely move on to gentle running on smooth, even surfaces. Now, a common myth is that running is bad for your cartilage. Many people believe that running wears joints down and causes arthritis, but research does not support this idea. In fact, numerous systematic reviews show that regular exercise, including running, actually protects cartilage and is linked with lower rates of knee pain and osteoarthritis. Even individuals who already have osteoarthritis can benefit from running when it is introduced slowly, gently, and with progressive loading. However, this does not apply to running that requires sudden changes of direction, like football or tennis, very long-distance running, marathons, half marathons, cross-country running on rough, uneven terrain, or heavy weightlifting that places high compressive forces on the joints. So how does exercise actually improve your cartilage? When joints are exposed to slowly increasing loads, the cartilage begins producing more glucosaminoglycans, the natural molecules that absorb water, add thickness, and help cartilage stay firm and resilient. This increase in glucosaminoglycans improves both cushioning and shock absorption. There is also research suggesting that supplements like chondroitin and glucosamine may support cartilage health by protecting the chondrocytes, the cells inside cartilage responsible for producing glucosaminoglycans and maintaining the structure. If you stay patient, keep your movement controlled, and follow the recommended approach of moderate, consistent exercise, you can strengthen your joints, improve cartilage quality, and stay active and mobile for many years to come.
Don't forget to like, comment, and subscribe for more amazing health videos on Health Fact 10M.